Okay, so a couple questions came up after I put out a study on the mailing list that type 2 diabetes remission 1 year after intensive lifestyle intervention, secondary analysis of a randomized clinical trial. So in that trial, they had people doing almost 60 minutes of exercise per day on 6 days out of the week. And yeah, what they found is that a third of people were able to go into remission. They did make some dietary changes, but it wasn't very extreme. And so the first question is this remission possible regardless of the duration of type 2 diabetes? Well, it may be possible, but in this study, they actually had people that have had type 2 diabetes for 10 years or less. So generally speaking, it's probably a lot more feasible for someone to put their diabetes in remission if they've had it for a shorter duration. Question number 2 is, can a low-carb diet also reverse type 2 diabetes? And yeah, there is some evidence for that. So in a article by Diabetes Canada, they do actually talk about low carbohydrate diets for people with diabetes. And yeah, if we take a look down here, it says that studies on low carbohydrate diets have shown similar improvements when compared to higher carbohydrate diets. Some also shows higher rates of diabetes remission, improved triglyceride levels, and reduced need for medication in the short term. So that article, I'll put a link in the description of the video. Okay, last question. Should the A1C be the gold standard for testing glucose in type 2 diabetes? I would say no, it's not, nor should it be. It is a good tool because it's simple. It doesn't require fasting. It doesn't require that you do it that often. You can do it every 3 to 4 months, and that will kind of tell you where your blood sugars are at. It is prone to some issues if there's any kind of condition that affects the health of the red blood cells in someone's body. So things like iron deficiency, for example, that would potentially cause you to have a less accurate A1C. But overall, I think it's a good and simple tool for people to know where their blood sugars have been and use that to kind of gauge their progress. If you have the ability to get a continuous glucose monitor, that can be a really nice tool to actually tell you moment to moment where your blood sugars are at. And then you can see, is it high blood sugars in the morning, the afternoon, or in the evening, and which meals are affecting my blood sugar more, how much impact is my exercise having. You can get a lot more specific with a continuous glucose monitor. But the A1C is a good test that, for what it is, it's a good tool.